today. He served as an assistant attorney general before beginning work at the Boone County Prosecutor's Office as an assistant prosecutor. He's prosecuted crimes ranging from traffic offenses to homicides. He has experience in private practice in school law, family law, and criminal defense. He was appointed as interim prosecutor in 2022 and elected in 2023 for his first full term. He grew up in a rural area in southern Missouri, not far from the Laura Ingalls Wilder home, before moving to Columbia to attend the University of Missouri, where he majored in political science. He returned to Columbia after graduating law school at WashU in St. Louis and began his legal career. And he now lives just outside Hallsville with his wife, daughter, and 2 dogs. Thanks so much for being here, Roger, and I will hand it off to you.
All right. Well, thanks everybody for having me. It is a very nice day, I think, to be inside for a remote meeting, but it does feel like a nice February day today at last. The discussion today is about mental health and specifically balancing mental health and treatment options and discussing the challenges that we have ongoing with individuals who are in custody at the jail and suffering from mental health issues. If we have time, I'm interested also in just talking about other things that we're doing and look forward to answering questions that you have. So what I want to talk about today, the first part is just why this issue is so important. First of all, secondly, explain a little bit about the legal framework for the problem and how we got where we are, and then talk a little bit about the current situation and challenges before transitioning into a discussion about what our efforts have been in this area and what some possible solutions could be. So the first part, talking about why this is important, that I can't talk about particular pending cases because of limits on pretrial publicity, but what we see on our side is in addition to just the things that are happening, a lot of times we see the criminal history of the people who are involved with incidents. And we've noticed over time that we have people who end up spending a lot of their time in custody, even if they're not necessarily there being sentenced to a term of commitment, that they end up spending a lot of time in custody because of repeated violations, oftentimes relatively low-level violations, but repeated over and over and again, so that the person is in a cycle where they will be arrested and delivered to the jail and then plead for time served and then are released into the community without any kind of treatment or support. And then the cycle continues that there'll be additional offenses and they'll be brought back to the jail. The other piece of the puzzle is the hospital that we have here, the university hospital that has a facility for emergency temporary placement of people in mental health crisis, and they can hold people for a 96-hour period. And oftentimes that's part of the cycle, that we'll have people that are delivered to the hospital for a 96-hour hold and assault somebody at the hospital and then are delivered to the jail. And so looking at some of these cases, we have people who spend a substantial part of their time and sometimes the majority of their time in custody. In addition to that, but beyond just the nuisance offenses, we can see in the criminal history that sometimes the people have really concerning prior convictions. We have a lot of people who are released from the Department of Corrections and come to Columbia because of the availability of services here. And we also have, at least by rumor from other counties, law enforcement agencies and medical professionals bringing people here to Columbia because of the psychiatric facility availability here. So that's created a real problem especially in certain areas of the community. Downtown, it's a major public safety risk that we have had some individuals that have engaged in really violent behavior. We have people who are disrupting businesses by going into the business and taking things, or intimidating and scaring staff and customers. We have young people who are working sometimes by themselves in these businesses downtown in the evening and are dealing with just really unpredictable individuals because you never know when you're dealing with somebody what kind of risk that they may pose. And it's really an especially big challenge right now in the downtown area and in the mall area in particular. And then I think the health and vitality of our whole community is really tied to the health of the downtown area, and it's critical that we pay attention to what's happening there. In addition to that, so on the public safety side, in addition to the challenges with being able to safely go downtown and being able to carry on business there and at the mall, we've noticed over time and had reports from hospital staff that there's been just a substantial increase in the number of assaults against nursing staff in particular, which has a huge effect on the hospital's ability to retain and hire staff there, as well as just the well-being and safety of the staff members. So our job as prosecutors is really to seek justice and do what is right and fair, rather than necessarily just trying to pursue convictions or just trying to have people arrested and taken off the street. It's an especially challenging responsibility in this area because we have to balance then the community safety needs with the needs of the individuals for treatment. And in the long term, I think by pursuing treatment goals that we can reduce criminal behavior and risk to the community in the long run. In the short term, we have a limited tool set, and there are a lot of the individuals that we see that I don't think should be in the jail. But the alternative is that they're in the community with no support and on this revolving door, in many cases, putting themselves in risk of harm and also putting people in the community in risk of harm. For example, one of the closed cases that comes to mind recently was an individual who was in court and pleading to a trespass case, but the trespass had escalated to the point where he had mental health issues that made him believe that he was on a divine mission and had the authority to go into anyone's house at any time that he wanted. And so he was arrested for just going into a stranger's house. And he was in court and pled and was released on time for time served, which means he goes back out in the community with no support and with a really high risk that he's going to go into a stranger's house, which is a really dangerous situation for him to be in. In addition to that, of course, we've had just some other really terrible incidents where we've had some stabbings, we've had assaults by punching involving people with mental health issues, and then over the last several years, we've noticed that a large number of our really serious cases, our homicide cases, involve mental health issues, and those things are all tied together. So we have a limited tool set, and I think not an ideal situation to have people in custody at the jail, but I think an even worse situation is the situation before that, which was we had all these people in the community with no help and resources. So that's why I think it's critical for us to find a solution. That we're spending a lot of money on housing people now. We're just doing it in a extremely inefficient and ineffective way. That it's expensive to house people at the jail. It's very expensive to house people at the hospital, and in the jail they just don't receive the treatment that they need because that's not the training and design of that facility. So one of our first efforts in this area was to try to work on having people evaluated for competency and then enlist the help of Department of Mental Health. And so in addition to talking about why it's important to look at this issue, the next area I wanted to talk about is the legal framework that we're dealing with. In Missouri, and I think actually in all states, there's a process where a person has to be evaluated for competency if you suspect that they're not competent in a criminal case. And competency is a very low bar, and it means that the person understands what's happening to them and that they can meaningfully communicate with and assist with their defense. And so what happens is the judge can order a competency evaluation on their own. Any party to the case can order a competency evaluation, but in most cases, only the defense attorney has the information available to them to request an evaluation because we don't ever have any personal communication with the defendants. We're not actually even allowed to do that. The judges only see the person very briefly when they're in court, and so oftentimes it would be the defense attorney requesting an evaluation. In Missouri, the process works by the judge ordering Department of Mental Health to do an evaluation. In the past, they would physically bring the person from the jail to the state hospital in Fulton, The evaluators gather all the materials from the criminal case. They gather the mental health and medical records for the individuals. They do observations, and then they do various interviews and examinations. The psychiatrist at the state hospital then will issue a report with an opinion about whether the person is competent to proceed or not. If they are competent to proceed, the case returns to criminal court and it just goes through the process as normal. If they're not competent to proceed, then they generally would remain in custody of the Department of Mental Health while they work on restoring competency. If the person is not able to be restored to competency, there's a process where after 6 months, they do another evaluation and report, and they make an opinion about whether they think that it's reasonable that the person will be able to be restored to competence. If they're not, then the case moves into a probate track rather than returning to the criminal side. So in theory, that's what's supposed to happen, is the person moves from the jail to the Department of Mental Health. And because of that, that's how we got involved in initially trying to find solutions for the mental health challenges. How we got really involved in this process is we were coordinating with victims in cases and coordinating with law enforcement officers, especially in the downtown area, to identify people who pose the greatest safety threat and had the most serious mental health issues. And we would use the information available from the police department and police officers to pursue a competency evaluation with the hopes that they could receive services then through Department of Mental Health. So that's part two, the legal framework. The roadblock we ran into is really the next thing to discuss, which is the current situation and challenges. So right now, the roadblock is that Department of Mental Health is simply just not taking people, or not taking people in a timely way. The number has been reported throughout the state that there are 285 people housed in jails throughout the state waiting for transport to the Department of Mental Health. The number in Boone County is around 25 people, which I think really that's just far too high. And I apologize, I don't see everybody's screen, but if you do have a question, feel free to jump in at any point.
I have one. I don't have any idea how many people or can we even house in the jail? 25 seats of how many?
About 183, I think.
Okay.
I'd have to double check to make
Yeah,
sure.
that's fine. I had no idea if it was 50 or yeah, so 183, close enough.
We also house some
Cool.
people out of county sometimes because of the jail maintains a certain amount of available space to handle changes in daily population. And so there's some people housed out of county. There are a large number of people housed out of county right now because there are individuals who can't be housed together because of ongoing conflicts. But overall, I think that's about the number of people that we have at the jail. So it looks like it's taken about 6 months for people to be evaluated by the Department of Mental Health. The statute requires them to do an evaluation within 60 days, but allows them to request an extension. And so essentially every case is they're requesting an extension. And so a person might sit in the jail for 6 months waiting just to be evaluated. Then we have also individuals who have been determined to be incompetent to proceed and committed to the custody of the Department of Mental Health, who are sitting in the jail waiting for transport and bed space to be available in the Department of Mental Health. We had one individual who was at the hospital, and I think for the benefit of everybody involved in the community, the hospital was willing to keep the person in their custody rather than requiring that he be delivered to the jail. But they were not equipped to deal with the individual. And over the course of about 8 months, there were over 40 assault referrals involving the person to our office. The judge had ordered a competency evaluation. It took from about March to November to get that done. And then in November, the judge found the individual was incompetent based on the evaluation and ordered the person delivered to the Department of Mental Health. And the Department of Mental Health just refused to get the person. So we engaged in some additional litigation and got an order specifically from the judge directing them to do that. And I'm waiting now to hear whether they've actually come and gotten the person. So Department of Mental Health indicates that they just don't have the staff and bed space to house people. And they report that throughout the state, they're getting a request for more competency evaluations than they ever have gotten in the past. Um, I guess I'll talk a little bit about this later in solutions, but looking at the Department of Mental Health budget, it's increased substantially. That I just looked at the numbers since 2021. Their budget in 2021 was $2.48 billion. In 22, $2.7 billion. 2023, $3.4 billion, and then in 2024, $4.2 billion. And it's I mean, a substantial increase in their budget, and it looks like between 2023 and 24 that there was a 300 million of that was a federal funding for a particular facility in Kansas City, but it's still a $488 million increase over the 2023 budget. So overall, it looks like Department of Mental Health is getting the funding they need, but they're not finding the staff that they need to fill the positions so that they can take the individuals. In the meantime, the people are sitting in jails and not receiving the treatment that they need to address their issues. And it's a real challenge for jails throughout the state, not just here in Boone County, that you have um, jail staff and corrections facilities who are not trained to provide special mental health services. And so you have continued risk to the jail staff, to the individuals and other inmates during this time period when they're being held at the jail, in addition to being very expensive for the county to do. So that's the current situation, is that we're working to try to find some solutions, but right now we have too many people waiting in the jail for transport for treatment. And I apologize, like I said, I don't have my full screen up so I can see my notes, and so feel free. I do see a hand. That's Sue Tillema. Do you have a question? Oh, and I think you're on mute.
I have a statement. I don't know
Okay.
exactly what's happening. And a lot of this, what you're talking about, goes back to where we deinstitutionalized the mentally ill, thinking that that would improve things, but it hasn't necessarily. But let me just mention, I haven't been working for the state for 15 years. But one thing that used to bother me, well, it bothered me terribly while I was working for the state, corrections officers got their pay compared to highway patrolmen and got pay that is way up in the pay scale as compared to psych aides, who are the bedside people in psych hospitals. And the psych hospital aides were compared to nurses' aides in nursing homes. Now, the danger is really great in the psych hospitals too. And so this to me goes back to traditionally male jobs versus female jobs. And this is part of the problem on handling why they can't get staff too.
Yeah, and I'll talk a little bit about maybe just my thoughts about how to address the staffing issues. But for locally, the correction staff at the jail are sheriff's department employees, and so funded through county budgets. The sheriff, I think, has done a good job with the resources they have. They do have a psychologist on staff that works with individuals, but it's a problem that is the tool for the problem is not the jail and the sheriff's department. It's just not the tool that's created that is designed for this problem. But right now, it's the only tool that we have available, and so that's what's being used.
And I was talking about state workers.
Right, yeah, on the Department of Corrections levels. And so I think
and corrections and Department of Mental Health. That was not fair for the mental health workers.
Yeah, and so I think pay and staffing at Department of Mental Health is going to be something that has to be addressed. The sheriff's department, I think, is doing some other things to attract staff there. There's a possibility that they may be able to offer daycare for employees, which would be a really tremendous benefit for the road deputies and detectives, as well as for the jail staff. Oh, and I see another hand. sorry, my screen switched off. So yeah, I'm because I'm looking at my notes, I can only see one picture at a time. So feel free to just jump in if you have a question.
Okay.
It doesn't bother me.
Okay, sorry, my question or comment had to do kind of following along with Sue. I am from Fulton, and I know that the state hospital there, where a lot of that assessment is supposed to be done, especially for incoming prisoners into the state prison system, is understaffed. And a lot of it has to do with other economic opportunities that have come up in that community, like the Dollar General warehouse. People can make more money at the Dollar General warehouse, just, working with packages, than they can per hour working in these extremely difficult jobs. And so recently, the Department of Mental Health had proposed to add on to that facility, but they then came back to the legislature and testified there was no use giving them money to build the facility because they could not get people to staff it. So it's a critical problem, I think.
I certainly do think that there are market factors at play, because there's been just a tremendous amount of change in the overall economy that we noticed for a time that for hiring our legal assistants and some of our victim assistants, that our competition is Target for those positions. And so the county's actually done a lot of work on addressing salaries, because I think to be successful in our mission, in any mission, you have to have quality people, and you have to be able to have enough stability that you can build up skills and institutional knowledge. So I know that the Department of Mental Health reports that staffing is really their challenge as far as being able to meet this issue. So the next thing I want to talk about is really having looked at those things, really why this is so important, the legal framework with competency, and then the current state of the problem, to talk through some possible solutions. So one possible thing would be to maybe put additional pressure on Department of Mental Health to address the staffing issues, because it looks like the legislature is willing to provide additional funds for Department of Mental Health. I know the governor mentioned mental health issues as well in his budget addresses. And so that's one possible area, I think, would be to be more aggressive in asking for Department of Mental Health to find a solution to the staffing issues. Some of the things that they are working on, and some of these are legislative things that Janet Thompson, the county commissioner for the Northern District, chairs a committee, steering committee for the Missouri Association of Counties on policing, justice, mental health. And they work on legislative efforts to try to find a solution to some of these issues. And then we also hear from speakers to talk about best practices and programs that people are trying elsewhere. Some of the legislative things that they're working on is, one, possibly expanding the qualifications of the people that would be able to complete mental health evaluations. I think there's some negatives to that, but it would maybe address the immediate need for the duration of time it takes to get the evaluation. The Department of Mental Health themselves have been working on doing some in-jail evaluations and also in-jail competency restoration, rather than moving them physically to the state hospital. And there was a change in statute to allow people to be released on bond pending the evaluation or competency restoration. I think the challenge with any of those efforts is that, well, and before I say that, there's also a push to require Department of Mental Health to pay counties to reimburse them for expenses of housing people while they're waiting for transport to the Department of Mental Health, to incentivize them to find a solution and move the people sooner. From my perspective, any of those possibilities, there are limitations, because competency restoration is just a small part of the problem. That if somebody is restored to competency, they come back and the criminal process goes forward, but it doesn't in the long term find a solution to provide support and treatment for them in the community, which is what's needed in the long term to correct and find a solution to our problem. Other things that we've been working on, Boone County is lucky to have very well developed treatment courts. It's a leader in the country on treatment courts, and one of our treatment courts is mental health court, and they have as well as a drug treatment court, but they also have a co-occurring court, because very frequently mental health and substance abuse issues overlap, and oftentimes people are self-medicating. So sometimes our goal in the criminal cases has been to try to get people into the treatment court, which is a really intensive program where they have support and resources available. A limitation on our ability there is that treatment court eligibility is only in cases where the offense is supervisable by probation and parole, which means that most misdemeanor cases aren't eligible for treatment court. So we've had some cases where we have a person that we're working on for a long period of time, where they're continuing to pick up minor offenses, but they're on our list of somebody who is a really concern that we should pay attention to. And eventually, if they're arrested with a felony amount of drugs, it allows us the ability to potentially get them into treatment court. We've had a little bit of a challenge. There was one case in particular where the person, we worked. A lot of people don't want to go to treatment court because, based on the nature of the mental illness, they sometimes don't have self-awareness that they're in need of treatment. And in addition to that, the process is really challenging and limiting. And so sometimes people don't want to do that. We had a case where we worked on a long time to try to get her into treatment court. She finally agreed. But then in the process of getting out of custody and going back physically to be at the treatment court, she picked up new offenses. And so we're still really working on trying to find an effective way to use treatment court to deal with this, especially unhoused population. I talked a little bit about Janet Thompson's efforts with the Missouri Association of Counties. She's been a real leader in this area for many years, and has been a resource for myself. I've talked with her about the need to get together a local steering committee so that we can develop some ideas for additional possible solutions and work towards making progress on those. Another thing that we've been doing is that we meet monthly with a committee that is led by Judge Stephanie Morrell, and it is a committee that's made up of prosecutors, somebody representative from the prosecutor's office, defense attorneys, jail staff, and mental health professionals. The Boone County actually won 2 of 5 awards from Missouri Association of County this year, and one of them was for Judge Morrell's efforts in the mental health staffing. My goal with the group, what we do is we get together and we look at the list of individuals who are in jail. We have the jail staff help us identify people who have serious mental health issues, and we go through the list and we look at what the status of the case is. My goal is to try to find an appropriate placement for the people, because while they're waiting for Department of Mental Health evaluation or transport, we can't really do anything in the criminal case. But one thing we could do is try to find a placement, and if we can find an appropriate placement where they can be safe, we could do a deferred prosecution where we essentially dismiss the case and agree not to refile it as long as the person doesn't commit new violations. Doing that would allow us to resolve the criminal case without having to do a competency restoration, and hopefully in the long term provide a more permanent benefit. Big limitation and a challenge in that area has been the difficulty in finding appropriate placement for people, especially people who have a history of assaultive behaviors. It's just very difficult nowadays to find a placement for individuals. The next thing that I've been working on, the more time that I spend working in this area and thinking about it, think that having better data tracking and information sharing would be helpful in finding a solution. I was able to go on a site visit to Kansas, to Johnson County, Kansas, and over to Lawrence, Kansas, and look at some of the things that they're doing there. They've got a program that they're model for other counties that they call their Frequent Faces Initiative, and it is a it's a data system where it's shared by healthcare providers, law enforcement officers. In Johnson County, they have a public ambulance district, and so information about when somebody has an ambulance trip is there. Information about when somebody is incarcerated is in the system. There are levels of access of information that you have because, of course, health privacy is a challenge in any kind of information sharing system, but they have a fairly complicated level of information availability where doctors, for example, might have access to all of the information, but a probation officer or a caseworker for a person might have access to a more limited set of information. In addition, there's some interesting things that they do with it. So in addition to just being able to share information, so you can look and see what other services the person is interacting with. One of the things they could do is they showed us an example of looking for somebody who needed rental assistance, and they could search in a particular geography for rental assistance, and it would provide information about who has those services available there. It would say what their hours are, what documentation that is required in order to enroll in those services. And so if you were a caseworker working with a person and you identify that they would need certain services, you would have the ability and access to that information. Other thing that surprised me as I work on this area is there's just a tremendous number of people in our county and community who are working on issues involving mental health and issues involving the unhoused population. And so I think, and there have been improvements in efforts towards better collaboration and data sharing, but I think that this system that they have was impressive. The other thing, though, that they can do with it is they use machine learning, and they look at it and they predict who's most likely to be a high user of services in the coming year. And they choose an arbitrary number of those people, and they proactively go out and make contact and provide services for those people, so that they're not then just waiting in the background for essentially what we're doing here is we kind of wait until there's a problem and then we try to figure out what to do. That it allows them to be proactive. They showed us some very interesting examples of individuals where you could really see this cycle where you'd have people that multiple times a month they are getting an ambulance ride to the hospital, either because of overdoses or mental health crisis. Then they also have multiple days where they're spending time in the jail. And so they talked about a couple individuals that were unhoused and were living under an overpass before their program started. And they were able to go and look at how many, what services were provided. And over the course of a couple of years, it was over $1 million that had been spent. And at the end of that time period, the two people were still living under the bridge. And so they hadn't really made progress. But the goal of the information sharing system is for those same individuals, they could identify in advance that they're likely to be high users of services and are in need of additional help and services, and so go out and work with them before they really use all those services. In the long run, possibly being more affordable for government. So that's one thing I think would be helpful is better data tracking and information sharing. Ultimately, though, the thing that I come back to is I think to find a solution for this issue in the long term, we have to find a housing solution that to me, it seems like assisted living in the community is maybe a possible solution, and to really make progress on these particular mental health issues that affect our work, we have to find a housing solution, because right now there just aren't enough placements for people. So that's really the portion of the talk that I have about mental health issues, and I'm happy to talk about that as much as you want. And I see Professor Tillema has a question.
Good to see you here. Thank you for
Hi.
coming. I was surprised you didn't say more about the Department of Corrections. I believe that the Department of Corrections is the single biggest provider of mental health services in the state of Missouri. It's also been the case that for the low appropriations for mental health have gone up in the last couple of years. It's been that's preceded by a 50-year regular decline in the fraction of money going to mental health versus Department of Corrections. Can you pull Department of Corrections into this conversation?
So partly, and the reason I didn't mention Department of Corrections is we don't have a lot of interaction with Department of Corrections. That the really most serious mental health issues and individuals that we're working with don't ever make it that far because they don't have capacity to be able to participate in the prosecution. And so in the long run, I do think Department of Corrections, it has to be part of the solution. That there have been a lot of efforts made towards more successful reintegration over time. We know as well that trauma is a big part of overall criminal behavior, and addressing trauma and mental health issues in the Department of Corrections. I think there could be some benefits. I'm just not as I don't work as much with the Department of Corrections side, because in the streamline, that's all down the road from where I am. I'm kind of on the intake side for the most part on the mental health issues. I do think you mentioned changes in funding over time. I've noticed a real change in the political will behind funding for mental health issues, in part because I think more public officials are being affected by mental health issues. Surprising number of people have dealt with family members who are struggling with bipolar. I think with the just tremendous increase in the opioid epidemic, a lot of people and their families are being affected by overdoses. And in addition to that, so many businesses are affected by people interrupting their operations. I just think there's a lot more political will now to find a solution for this issue than there ever has been in the past. And I saw a question. Oh, there you go.
I have a question. Yes. What's the status of Oxford houses in the community at this time?
So Oxford Houses, you have to help me refresh my memory. Is it a sober living facility?
Oh, yes.
So sober living facilities are a big part of the possible solution here. I do know that sometimes that there are problems where you have people with assaultive behaviors may not be able to integrate into those facilities. We have also among the different things that we've worked on, we tried to work with Into Action to try to maybe have some people who are in the jail pretrial on bond transferred there for rather than being held in custody at the jail. But it's a faith-based organization, and so it requires people to opt into that. But other options, we just haven't explored on our side as much of using sober living facilities as a pretrial solution.
Yeah, because there are actually some people in those that do have assaultive behavior, but they do pretty well in that kind of facility. So that's and certainly there are many people without the assaultive behavior and the mental illness.
Oh yeah, definitely. And so that's something that we'll think about, and that's something that is I've heard other people mention as a possibility. Ms. Tyler?
Hi, this is at the other end of the process. A person pleads guilty by reason of insanity and then is in an institution for whatever length of time. What happens when that person is under medication and successfully managing his life while under medication, but what happens when it's time to get back in the community, return to the community?
So for somebody who has been found not guilty by reason of mental disease or defect, they're transferred to the custody of the Department of Mental Health. There's a process where they do regular evaluations and a psychologist makes an opinion about what level of security is appropriate and needed based on their risk of harm to themselves and others. One of the benefits of the Department of Mental Health over the criminal side for dealing with these issues is that they have a whole range of kind of a spectrum of possible levels of custody, from individuals who are in secure facilities. They also have in the possibility that people can be in group homes. or they can be in assisted living facilities. There's even a possibility that a person could be determined to no longer be a risk to themselves and others and be released on unconditional release. And so mostly those decisions are made by the Department of Mental Health, but there's a statute that allows an individual every year to request a judge to review their custody level as well and make a determination about whether their custody should stay the same or be reduced.
Thank you.
And I should add, I guess, too, with competency evaluations, in those situations, my feeling is that the largest number of people who are able to be restored to competence are because of medication that they receive at the Department of Mental Health. And the real challenge there is then if they come back into the criminal system and they may not be able to have those medications, or even at the end of the criminal case, if they don't have that medication, we're really back to where we started from. Do I see any other questions?
Can you
Yeah,
see my questions in the chat?
Oh,
go
I'm
ahead,
sorry. I
Wiley.
don't have the chat open. Let me look at it real quick.
Oh, okay. And Wiley has a question. Go ahead with his.
well,
So
I'll wait until we deal with the chat.
the first question, it looks like, does the Boone County Sheriff's have mental health professional who goes with deputies on possible suicide calls? So I don't know currently if they have somebody who actually goes out on dispatches. They have a psychologist who works at the jail. One of the things that we saw and actually I've seen in a couple counties, other counties now in other states, that they have mental health responders, and that's something else that we've been working on, advocating, especially right now, mostly with the City of Columbia and Columbia Police Department, to have mental health responders or co-responders. In some areas, they've been able to get federal grants, SAMHSA grants, to fund that, and so I think that's one possible avenue of improvement would be to have mental health experts or social workers even that could go and respond to mental health crises. The next question was input on getting Columbia Police to obtain mental health professionals. Oh, and actually, sorry, same question. And so the particular case mentioned, like I said, I can't talk about any pending case. In cases involving shootings by local police agencies that we work with, we generally have a special prosecutor review those to make sure that there's not any kind of bias introduced based on our relationship with the person. But mental health responders definitely, I think, could be part of the solution to the issue and something that we've been advocating for. Any other questions?
Yes, I have one. I was a little slow getting in, so you might have commented about this and I missed it, but I didn't hear any comments regarding children. I know that many children who run afoul of the law have all sorts of psychological and developmental problems. And unfortunately, when children commit rather heinous crimes, they are often certified as adults and can receive extraordinarily stiff sentences. I don't think that happens all that much here in Boone County, but it certainly happens around the state. So, what sorts of services and treatment do you see for children?
So for children, we generally only see the ones that are certified by the juvenile office. And I don't think currently we have cases involving mental health issues or substantial mental health issues. I do know that the school has resources available, but for the most part, the juvenile process is just separated from the work that we're doing. And so I'm not as aware of how they're handling the issues.
Okay.
And then Ms. Turner, did you have a question?
I do, and it's kind of a follow-up on what Wiley said. Is there a way to get people into the criminal system, but that has its negatives, who do overdose? Like, I had a friend who someone lived with him who overdosed, but he went to the hospital, but he was released the next morning without psychological help, and I guess no charge. But then he wasn't in the system to get help. Then eventually, this is a formerly unhoused individual that was living with him and working then. He had money from working. He got more drugs. He overdosed and he ID'd in his home. That guy needed help, but he's outside the system in a way.
Right. So that's the issues with overdoses, especially in that's on my list of things to talk about in other goings on. And so I'll transition a little and talk about that.
Thank you.
And directly to your question, Missouri has a Good Samaritan law. And so if somebody calls police, one of the things we try to do is make sure people are aware of this, because we have, unfortunately, too many cases where people are scared of getting in trouble and don't call for help for their friends. But if somebody calls for help for a friend who is overdosing, then they can't be charged with possession. And so that would keep them out of the criminal system for the most part. Fentanyl levels, there's a trafficking charge, and trafficking isn't excluded by the Good Samaritan law. And the amount of fentanyl that qualifies for trafficking is so small that in some of those cases we may be able to get them engaged into treatment through the criminal system. I've been trying to talk as much as I can in the media about the problems with especially with fentanyl in the community, that in Boone County, by far the leading cause of death from criminal activity is overdose. That we had 50 overdose cases in Boone County last year. It's more than traffic fatalities and shootings combined. And so we've spent a lot of time and effort on working on things that we could do to address those issues. On one hand, we are more aggressively pursuing drug dealers, especially fentanyl dealers, because right now, the other thing I've been trying to draw attention to is that really the method of fentanyl delivery now in our community are counterfeit Percocet pills. And so the detectives tell me that the regular users know when they're getting the pills that they're fentanyl, but there's a risk for people who don't know that. And then, of course, fentanyl is so strong that the risk with these counterfeit pills is it just takes a tiny extra amount of fentanyl on that particular pill in order to cause somebody to overdose. The DEA did some testing that found that just a huge number of these pills have in a single pill enough to potentially cause an overdose. So we're trying to raise awareness about those things, but also more aggressively pursuing drug dealers who are profiting off of the addiction and struggles of people in our community. At the same time, for simple possession cases, we've worked on trying to find out, trying to think about an effective and meaningful way to handle those. And what we're doing now is we have an initiative to shift all of those cases from the criminal track into a treatment track. And so with the exception of, we have some individuals who we know are violent offenders in other ways, or there may be other reasons why we wouldn't agree to do this. But for the vast majority of, and nearly all of our simple possession cases, we're recommending that they be diverted to treatment court. The mechanical way that works is that they plead guilty to the possession charge, but rather than being sentenced, they're diverted into treatment court. If they successfully complete treatment court, then they withdraw their plea and we dismiss the charge. If they unsuccessfully complete, then they proceed to sentencing. Although we've made a commitment that for the individuals that we're diverting to treatment court, we know that recovery is a long process. And so if they're unsuccessful in treatment court because of a relapse or because of something that wasn't committing some other criminal offense, then we're going to be recommending that they go back into treatment. Part of the reason for that is because of the number of overdoses that you mentioned, that I feel like we've gotten some pushback from attorneys, especially about implementing this program, because some people are saying that that not everybody who's found with felony drugs needs treatment, which I'm not really sure that I agree with. But the bigger concern that I have is that we know that a certain number of those people will end up overdosing because of addiction. We know that addiction has a tendency to increase over time, and people end up being engaged in other criminal behavior. And we also know that it just has a really terrible effect on family and children in particular. And so that's our effort. And then the alternative is, in cases where people won't agree to go into treatment court, we're recommending that we do treatment through the Department of Corrections as kind of as a really a carrot and a stick effect. But that's one of our big efforts right now, is that we're really trying to shift simple possession cases into treatment out of the criminal system so that they do receive treatment. And ideally, if they're successful, won't come out of it with a conviction that can have other negative consequences. Other reason we're doing this is because, as you mentioned, for a lot of people, the criminal system and the resources available in the criminal system are the only opportunity that people will have to get treatment. And so that's we've been doing that since about October, November, and still gauging how that is going, but I'm optimistic.
Thank you.
Any other questions?
I'd just like to make a quick comment. It's no secret that the office Roger took over had abundant deferred maintenance, to putting it probably as charitably and as gently as we can see, under the tragic circumstances under which he had to take over that office and how suddenly he had to do it. But I want to commend him for the fact that he is, without any adverse comments at all, has diligently rolled up his sleeves, dug in, started, and is doing everything he can with his capacity, his budget, the severe hiring limitations all of us have now, to make that office a credible, strong, respected office. And Roger, I want to tell you, we appreciate it. Good luck.
I do appreciate that, and I appreciate all your support. I would say nothing we do here is an individual effort, and so it really is a team that we're building. And we have a lot of people here dedicated to trying to do the right thing and trying to advance our mission. And so I'm really optimistic, continue to be optimistic about what we can achieve, despite some of these challenges, the mental health issues, especially. If it were an easy problem, somebody would have fixed it a long time ago. But it's going to take a lot of time and people smarter than me to find solutions to the problems. But I do very much appreciate your kind words. Anybody else have any questions?
We really appreciate your being here today, Roger, and the job that you're doing. So thank you very much.
Yeah, thank you all so much for having me. I'm always happy to talk any opportunity that I can talk about what we're doing. I think on my list of goings on, one of them is major challenges that we have as an office. And I think in the time that I've been working as a prosecutor, I've seen just a tremendous shift in our culture where people just aren't willing to be engaged in the process. They don't necessarily trust what we're doing. And I think part of that is because the only time people hear about prosecutors and prosecutors' offices is when something goes terribly wrong. And so my goal is to try to get out and talk about what we're doing as much as I possibly can. And so I'm really grateful for you all to give me the opportunity to talk about that a little bit. I'm always happy if you have other things that you're interested to learn about. I'm always happy to come back and talk with you more. So thank you all really very much for having me today.
Thank you.
Thank you.
Okay, let's continue with our regular meeting. And I guess I will ask, does anybody have any announcements, or anything they want to talk about?